Good evening, everyone. This is Julia O'Hara with USF Housing and Residential Education. I'm joined by Anna Hernandez, Assistant Vice President of USF Housing and Residential Education, and Dr. Joseph Puccio, Executive and Medical Director with USF Student Health Services. We are live and here to provide information about COVID-19 testing, isolation protocol, and support for on-campus residents. So type your questions in the comments and we will answer you live on the show. So to get started, thank you so much, Anna and Dr. Puccio, for joining me this evening. How are you both doing?
Doing well, thank you.
Great. So last week, we did talk to Anna a lot about the on-campus isolation protocol, and some questions came in that were student health services related and would be great to ask Dr. Puccio. So we're going to get started with asking Dr. Puccio a couple of questions that we did receive last week and a couple other pre-planned questions. Ask your questions from the audience as we go along, and I will be asking those as well to Dr. Puccio, and if any of them are housing related, we'll have Anna answer those questions. So to get started, Dr. Puccio, let's start with an overview of the USF Daily Symptom Check. Some people asked about that last week, and I wondered if you could give an overview of what that is and what the purpose is.
Sure, thank you for that question.
Mm-hmm.
The symptom tracker, or the symptom checker, is really a tool that the university is using on all of its campuses to assess the situation or the individual situation about how they're feeling. Have they been exposed to anyone that may have been recently diagnosed with COVID-19, or have they been recently tested because they're concerned about something? And this way we would be able to directly interact with the student, faculty, and staff to determine if they are at risk, and if we need to isolate them from campus for a period of time until we figure out what's going on.
Got it.
It is something that is requested that everyone do whenever they're expected to come to campus. It is very easy that if they are not coming to campus, that they could just click no, that they're not coming to campus, and then that ends the symptom tracker. But we do want to know all of that information if they are coming to campus.
Absolutely. I work remotely most of the time. I'm in the studio today, as you can see, but I do it every day. It's very easy and it's really, really great to use. So another question that we also got last week that we were wondering if you could provide an overview for is what pool testing is and how it works.
Okay, pool testing is a relatively new thing that we're doing over at the university. It is not something new in science. What we are looking to do with pool testing is we're looking to test large numbers of people relatively quickly. And what we do with that is we take a series or a few people and combine their specimens. So currently right now we're doing saliva samplings. So what we do is we take a portion of the sample that has been submitted and we put them all together and we test 5 people at a time. And if all 5 people are negative, they're considered negative. However, if it comes up positive, then what we are looking at is we have to individually test each of those people to see who is negative and who is positive. The benefit of this is, like I said, we're able to test a large number of people relatively quickly and relatively economically affordable.
Great. So last week we talked a lot about the isolation process. So my next question is getting into the details of isolation on campus. But first, before we jump into that question, can you let the audience know why a resident would need to go into isolation? What are the different scenarios that would cause that?
So there are basically 3 different scenarios. One scenario is that a person is symptomatic. They basically have signs and symptoms of COVID-19, which we want to put somebody in isolation to remove them from the general population. Why we try to figure out is if this is COVID or if this is another respiratory illness, such as strep throat, flu, any of those type of illnesses. The second scenario would be somebody that lives with somebody, who we call a high-risk contact, and they live with somebody that has been diagnosed with COVID-19. So that person needs to go into isolation for 14 days because it could take up to 14 days for a person to develop symptoms or to develop the antibodies or the antigens that determine whether somebody is positive for COVID-19. The third category is somebody who has tested positive for COVID-19, and that person again needs to be isolated from the general population so that they don't run the risk of spreading the infection to other members of the community. So we basically, when we're looking at every student, their risk factors, we look at those three categories and we determine which one do they fall into. If they don't fall into any of those categories, they don't become isolated.
Makes sense. Thank you. So Michelle is asking a question that I'll bring up now because it goes along with your answer there. Why, if tested negative in the rapid and PCR test, would a student still have to isolate? So would the scenario be there most likely for the first two examples that you gave, they may fall under that category?
So yes, it is a little bit of an individualized scenario sometimes, but in general is that if somebody is symptomatic and they don't have any high-risk contacts, usually we will wait for the PCR test to confirm that somebody is negative, and then many times we will release them. However, if they do have a high-risk contact, meaning that they were in contact with somebody who was COVID-19 positive, then we would need to leave somebody, even if they have two negatives, we would need to leave them in isolation for the full 14 days.
All right, thank you. And so we'll move over to the next question that we had pre-planned. Can students isolate off campus?
So if a student has a place to go off campus that doesn't involve potentially infecting another person, or has a place where there's somebody that is not at a high risk for a pre-existing condition that could have a pretty significant adverse effect, then that person could isolate at that location off campus. We are trying to keep as many people on campus if possible because we don't want to spread COVID to the community, but we do understand that people will feel more comfortable sometimes isolating in areas where they feel like they are just more comfortable there.
Right. Well, thank you for that answer. I'm going to ask another question from the audience that also has to do with the scenario that we just discussed, isolating off campus. Vivian is asking,
Yes.
if a student tested positive and left campus to isolate at home, what do they need to do to return to campus? They have been tested at a facility off campus.
So one of the first things that we need to do is that if they do test at an off-campus facility, we need to get a copy of their positive or negative test results so that we're able to make a determination. Many times people say, oh, I was tested positive at this place. But we really, in order to protect the community, we need to have a laboratory report that says that a person specifically tested positive and what type of test result was it. Many times people may be going to different facilities that test different ways, and some of those tests may not be acceptable in making a determination whether you're still contagious or not. So that's why we do want to see the test result. The other thing is that if you are off campus and you do want to come back, we do need to discuss with you the scenario of what has gone on. What happened that you went into isolation? Were you symptomatic? When did symptoms develop? Excuse me. Was your roommate positive and you decided to move off campus and then you became symptomatic? So in many different scenarios such as those, we do need to talk to each individual person. So that's why we tried to set up a telehealth appointment to spend time trying to figure out what are the conditions. And I know many times there have been people that have gone into a 14-day isolation and the circumstances have changed over the course of those 14 days. That's why it's important that at the end of the isolation period that we get in contact with you so we could review the whole scenario. We want to review how you are feeling, first of all. That's the most important thing. And to make the determination if it's safe for you to come back into the general community.
Got it. So it definitely comes back to an individualized support and scenario a lot of the time too. So
That is correct.
So off of that point, one of the questions that we did get last week, and then I'm seeing again a couple of questions from the audience relating to students on campus in isolation. Are they tested throughout their isolation for COVID-19?
So it depends on the scenario. Obviously, if someone tests positive, we do not retest until we get a negative, because many reports have come out that a person could still continue to have a positive PCR for COVID-19 for up to 12 or 16 weeks after the diagnosis. So many people do clear early, but there's also a very large number of people that still can detect the COVID genetic material and therefore give a false positive. So once you test positive, we will not retest you during your isolation period. For somebody that is symptomatic, we may continue testing you there, especially if you are still having your symptoms, if you're getting worse, and we cannot explain for your illness during that time. We will continue testing you until we figure out what's going on and before we feel comfortable releasing you to the general community. For somebody that is a high-risk contact, we really try to test people, not so much when they first go into isolation. We want to try to wait a couple of days while you're in isolation, because the natural process does take a couple of days before we are able to detect a virus using the technology that we currently have. So usually for our rapid antigen and PCR, we usually do try to wait about 5 to 6 days before we retest you. And we're hoping by that time, if you are positive, we will see the antigen develop at that time. However, we have had a couple of people that during those 14 days while in isolation, they have had their negative antigen, they've had negative PCR at day 5, 6, or 7, and then day 11 or 12, they start developing symptoms, and the common symptoms like loss of taste, runny nose, and sore throat. So then we've had to test them again, and at that point, they test positive, and then we need to continue their isolation for the additional 10 days. So again, it's a very individualized process that I know can be frustrating, but it is something that we have to do to protect everyone in the community.
Got it. And you touched on this a little bit. The next question is about a student's health during isolation. So this is a question we did receive last week. What happens if a student's health worsens while in isolation? What's the process with supporting that student?
So there's a couple of things that we're equipped to do. The first thing is, obviously, if the student feels like they're deteriorating and they could always call Student Health and say they want to get another telehealth appointment so they could speak with a provider. The providers are doing periodic check-in phone calls or check-in telehealth appointments just to check in to see if people are worsening. The other option is that if a person, after the telehealth appointment, that we are kind of concerned because we see that the symptoms are worsening and the scenario is worsening, we may do one or two things. We may actually have you come into Student Health, into an area where we are prepared with all the personal protective equipment to evaluate you in an appropriate manner. If we feel that your condition has deteriorated significantly, we are equipped to have you transferred over to an emergency room so that you could be better evaluated and have the technology that is needed to assess your situation better. We are capable of doing all of those.
Right. And Elizabeth is asking from the audience, based on the comments that we were talking about earlier, if someone has symptoms similar to a cold or even allergies, would they still need to get tested for COVID? I think this question came after talking about those who may be symptomatic.
So yeah, I mean, that's a great question. And I know this is one of the questions that many students get frustrated over. The symptoms of COVID-19 are such basic cold-like symptoms. We've seen people with just a runny nose and they come up positive right away. Then we've seen people with a runny nose, sore throat, and a fever, which is what everybody experiences this time of the year, especially when people come back to college. It's common. Many viruses give those symptoms. And just as the other viruses, these are the symptoms of COVID. And if we see them, we have to assume that it's COVID until it's proven otherwise. So if you're symptomatic with a runny nose or a sore throat and you have had no other contacts, what we will do is we will test you. And if your tests come back negative and you're improving and you have no high-risk contacts, we will release you from isolation. But if you have a high-risk contact or you seem like your condition is worsening, we may want to retest you before we release you.
And a question that we also received last week were about roommates quarantining together. Is that something that's possible at this time?
So that is really a scenario-based question, because if a person is positive for COVID-19 and the roommate is negative for COVID-19, we do not want them to isolate together. We don't want people to become infected with COVID-19. So we don't want to put people at increased risk of developing the illness. We know that during the time period there was a risk, and we want to try to mitigate any further risk. So we would not put people together that are discordant in their test results. So a positive and a negative, we would not put them together. However, if both roommates are positive for COVID-19, we will try, if the facilities exist, we will try to put positives together. On the same measure, we still would not put two negatives together, because we don't know during that time period if one person develops symptoms and becomes positive. We didn't want to put the other person who potentially may be negative at increased risk. So at this point, the only time that two roommates would be able to isolate together or quarantine together would be if they are both positives.
Right, that makes sense. Thank you. And we're receiving a specific question from an audience member. Michelle is asking, if a student goes into isolation for 14 days because of an exposure and starts showing symptoms on day 13, does the student have to stay for another 10 days?
If they test positive for COVID, yes, they will have to be isolated for an additional 10 days.
And what about symptom-wise, if it's just the symptoms at the end of their isolation period? They get tested and then go from there?
Yeah, we would have to we'd have to test them, and we would have to evaluate the situation. It depends on what the symptoms are, what's the duration of them, are the symptoms getting worse? So it's a lot more details that we would have to get before we can give a clear-cut answer on that scenario.
Right. And Anna, this question is touching on what we talked a lot about last week. So there is a question from Kathy about if a student's in isolation and the contact from the care team has not been meeting the expectation or the standard that's set by housing, what steps can that student take to ensure that they are following up, or we are following up with those individuals to make sure that they're getting the support that they need?
Thank you for the question. So students are given a COVID care team member, which is basically their initial contact and the person that should be getting in contact with them throughout their stay. And the student and the COVID care team member navigate how often that will occur. If it is that the student is not satisfied or is looking for more contact and is not getting the response that they expect from the COVID care team member, there is also staff that are on duty. And so what we would ask the student to do is to contact the duty number and just explain what their circumstances are. The same would be if it is that they're reaching out to the dining number and are not getting the response that they're expecting, is that they should call the duty number. You know, we have staff that are on call that are separate from the COVID care team members. And so that basically escalates it to the next level. If it is that there's an ongoing issue and those systems that we have in place are not responding, then the student or the family member can contact either housing@usf.edu, and they will make those connections, or they'll send it over to me. And so you can contact me as well. So we certainly want students to feel that they're supported and are getting what they need while they're in their isolation.
Thank you for that, Anna. And this question is for Dr. Puccio from a viewer. What if a student has a close contact but has already had COVID? Will they have to isolate again if they test negative?
That's a great question, and thank you for that question. That is actually one of the biggest challenges that all medical professionals are experiencing right now, because we don't have sufficient evidence to say that a person can't get reinfected. It depends on a couple of things need to be taken into consideration. First, when was the initial infection? When were they diagnosed with COVID-19? Some of the evidence supports that if an infection was over 16 weeks ago, it is probably beneficial to retest a person as if they never had the illness before, because there have been some reports of people contracting COVID a second time. Now, in those scenarios, we would probably be doing different testing at the same time. We wouldn't just do the antigen and the PCR testing, which is the predominant testing that we do. In these circumstances, we would probably want to do some serological testing, or what we call antibody testing, to see what antibodies may be present. The antibody tests have not been perfected, so it does make it a little more challenging to resolve that scenario. We have had a couple of situations that fell into this category, and when we checked the antibodies were able to give us the answer in that scenario. If they did not have active antibody and they did not have active antigen, we were able to determine that this was the results were an old infection, and we did not have to isolate that particular person.
All right, and that touches on another question that I'm seeing from a viewer. Marcy is asking if any antibody testing is being done. So that's, I'm assuming, on a case-by-case basis, or would you like to answer Marcy's question on that?
So predominantly we are doing it on a case-by-case basis, because there has really been no direction on how we should evaluate antibody tests. We know in the specific example that I had just discussed, there is direct criteria that we could use for that. However, in general, we do know that some of the antibody tests are not perfect, so we may see false positives, and we may see some false negatives. So it's hard to use that as a general screening tool, and that's why we have limited our tools to basically antigen testing and PCR testing.
Thank you. And Natalie is asking, will my student who tested negative before isolation be retested before released from isolation if they are not showing symptoms?
So if somebody was a high-risk contact and is in isolation for 14 days, if they had a negative PCR at the beginning of isolation and they have shown that they have developed no signs, we are trying to test them in the middle of their isolation for development of the antigen or a positive PCR. At the end of the 14 days, the CDC criteria does not require us to, or does not recommend, I shouldn't use the word require, does not recommend that we repeat the testing. However, if somebody does say that they feel any kind of illness, we do retest them immediately. But if they're in isolation and they show no signs of illness and their 5, 6 day, 7 day antigen PCR test is negative, we do not repeat the test.
Thank you. This is a great question from a viewer. My student is just getting over COVID. How long would you recommend they wait before getting the flu vaccine?
That is a great question. Whenever somebody receives the flu vaccine, we always want to make sure that they have minimal any types of cold-like symptoms when they get the flu shot. So really, if somebody did test positive for COVID-19, I'm just going to say 2 weeks ago, we really want them to wait at least 2 to 3 weeks before they would actually get the flu shot, just to give them time to recuperate and give their body some time to feel better. If they do have lingering symptoms, I would recommend before they do get the flu shot that they do touch base with a medical provider so we can evaluate the situation and determine if it is best for them to get the flu shot at that time.
Great, thank
Thank
you.
you for asking that question. It was a great question.
Yeah, and while we're on the topic, Dr. Puccio, I know that you have a lot of information regarding the flu shot and the resources that are available on campus for students to go and get the flu shot. Without, going into too much detail about why it's important and the flu shot in particular, would you be able to give an overview of how a student could go about making that appointment to get the flu shot this year?
Sure. I feel that I have to go over a little bit of why the flu shot is important. So I'm not gonna miss that chance to talk about it a little bit. As I mentioned, COVID is very, very similar to a lot of illnesses, in particular the flu. So anything we could do to help eliminate a possible option of, is this COVID or is this something else? And the flu shot is your best is your best tool to try to rule out the flu. We all know that the flu shot is not 100%, but it is definitely better than nothing. We don't know what it's going to be like if people get COVID and flu together. We are thinking that that is going to be a really, really significant illness, and even young people are really, really knocked down when they get the flu. So if they get the flu and COVID, they could be sick for quite a while. So it's really, really important to try to put something in your defense to prevent from getting seriously ill. And getting the flu shot is probably right now one of your best defenses. So I do really strongly encourage everyone to get the flu shot. If you have questions whether you think the flu shot is right for you, please don't hesitate to call, make an appointment with a provider, speak to our nursing staff, and we will evaluate your situation. If we don't know, we will reach out to our infectious disease colleagues at USF Health. We work as a team, and we want to make sure everyone is protected as best as possible. Now, towards the question of how you can get a flu shot. We are in the process of ramping up getting flu shots available all throughout campus. Currently, right now, as we are in that process, we are offering flu shots at SHS. We just started this Monday. So if anyone is interested in getting a flu shot, feel free to call Student Health and say that you would like a flu shot. They'll schedule you an appointment. We do have quite a bit of appointments available for people to get the flu shot. If you're a student, there is no charge for you to get the flu shot. So I really encourage people to call, make an appointment early. There is the recommendation that everyone should try to get vaccinated before November, particularly in the Florida area. We start seeing spikes of the flu usually at the end of October, early November. So we want to make sure that people get protected before that time period.
Got it. Thank you, Dr. Puccio, for that information. And I have a question from a viewer asking specifically if telehealth appointments can be done every morning to check in on students in isolation. The viewer is concerned about reports from parents saying that students are not in contact with a USF team member as much as the family member or the student would have liked. So I guess the first part of that question can be, is the telehealth appointment, is that something that a student is responsible for scheduling for their experience, or what is the process with scheduling that appointment, and how often is a student able to?
Thank you for that question. That is really a good question. If a student feels at any time they want to meet with a provider, they can call Student Health and we will schedule them with a telehealth appointment. During this process where we're having a lot of students testing positive, we are trying to do in many different ways outreaches to students in regards to checking in on how they're doing. We have a two-step process. One is phone calls, the other is setting up telehealth appointments. One of the things is that we have so many students that we're evaluating on an individual basis that we only have a certain number of telehealth appointments in a day. Now, if students are concerned, by all means, we will do whatever it is that we need to do to address those concerns. So if a student has a concern, please call Student Health to set up an appointment, a telehealth appointment. If a lot of times we were getting information from students that we were calling them too much, and they asked us to please stop scheduling these appointments. So we're trying to find the right balance. But I think the bottom line that I want to get out there is that if you feel something is going on, if you're nervous about something and you want to have a telehealth appointment, please contact us and we will make sure that you get a telehealth appointment scheduled.
Thank you for that, Dr. Puccio.
And Julia, can I add on to that response?
Absolutely.
I just wanted to say we can certainly make sure that if it is that it's just contact that is needed and not necessarily consult with the medical professionals, we can absolutely schedule that with the COVID care team or the on-call staff. And so if that is that has been requested and that is not happening, and it's not necessarily medically related that you want that point of contact, please feel free to email housing@usf.edu, get in contact with me, and we'll make sure that the COVID care team member understands that that's what the student is requesting. Sometimes what the student is requesting and what the family is most comfortable with may be misaligned, and so we need to make sure that we get some alignment in that and we know the best way to reach the students. But I also want to be cognizant that the medical staff are very, very pressed with regard to trying to respond to this. And so if the COVID care team can serve in that function of a daily contact, we certainly want to make sure that we can facilitate that.
Thank you for that, Anna. And about the telehealth appointments specifically, Dr. Puccio, this is a question that we had written down to ask you further details about for this week. We got this last week a lot. If there's a cost for telehealth appointments or COVID testing while students are in isolation.
So for telehealth, there's no appointment. At Student Health Services, any type of primary care appointment, there's never a charge for that service. If you do have insurance, we will run the insurance, but there will be no cost to you as an individual. If you don't have insurance, we don't ask you for any type of copay or any type of payment. As far as COVID testing, for students at the university, we are not charging any student to get tested for COVID.
Got it. Thank you, Dr. Puccio. And we were talking about the staff on duty call number earlier. So Anna, this question I think would be best directed towards you with where do students get that staff on duty call number to call, whether it be the Student Health Services contact, dining contact, COVID care contact. Can you go over a little bit about what information is provided to them and how?
Absolutely. When a student arrives in isolation, they are contacted by a COVID care team member to facilitate the logistics of getting into the isolation location. Once they arrive inside their room, there are several numbers. All of these numbers are posted in the isolation room. In addition, students receive an email that has the point of contact for the COVID care team member, the student health contact information, dining contact information, duty contact information. So all of that is included in the email. And so if we have students and or family members that are hearing from students that can't remember where all the numbers are, because we recognize that it's jarring, to say the least, to get a call that says either you've tested positive or that you've become a close contact and you have an hour to go into isolation. And so if you can just remind them to refer to the email that was sent to them in their usf.edu email box, that would be great. And all of the contact information is there. And again, as a default, they can always go to housing@usf.edu and we will get the right contacts to them.
Thank you, Anna. A follow-up question to that from Lynn. Are COVID care team members available 24 hours a day? What happens when a student needs help in the middle of the night?
So the COVID care team members are volunteers that are existing staff that have full-time jobs on campus, and so they are helping us with trying to do this outreach and doing these outreach to the staff members. So the COVID care team members are not necessarily available 24 hours, 7 days a week, but more so during the business hours. However, we do have duty staff, so staff that are on duty, that if there is an urgent issue that can't wait until the next business day, they would be certainly able to respond and make those connections for the students. So it's just a different call structure that we have. So the support is there 24/7. It just may not be the COVID care team member.
Right. Thank you for that, Anna. And Dr. Puccio, a question from a viewer. Are there many false positives with the PCR testing? Or if our student tests positive, should we be fairly confident that they do have COVID-19?
Okay, so that's a great question. The PCR test is extremely accurate. It is very highly sensitive and very highly specific. So when we do the PCR test, if the PCR test comes up positive, we have a very, very good deal of confidence that a person is positive. The rapid antigen is a little different, and that's why we do the two tests. The rapid antigen, if it tests positive, it is very, very reliable. However, if it is negative, it's not so reliable, and that's where we rely on the PCR test, particularly in those circumstances. I will say, in all the cases that we've pretty much had almost 100% agreement with a positive antigen and a positive PCR. There's been, I'm going to say, less than 5 or 6 that there was discordant results, but for the most part, they've been very, very accurate and agreeing in their test results.
Great, and thank you to the viewers for asking these great questions that we're getting through, and thank you to both of you for your great answers. Jennifer is asking, if a student is asymptomatic and not known to be exposed, but wants a COVID test before being in contact with family who may be more vulnerable, can they get one at Student Health Services or anywhere else on campus to be tested?
So what we would do in a circumstance like that is we would really recommend to use the Hillsborough County testing site that is on campus and is operational 5 days a week. And we do that only to make sure that we secure our supplies for the students that are most ill or at highest risk. The county does operate that testing site, like I said, Monday through Friday, and you can call and you can schedule an appointment, and it's very fast to go through, and you get your results in a very timely fashion within 72 hours as well.
Great, thank you. And we're getting some questions from viewers about how many students are currently in isolation and if that number is decreasing, stable, or increasing. Dr. Puccio, are you able to provide any information on that?
I would basically say right now it's pretty stable. The hard part is really to kind of judge is because people are going in and coming out all the time. But at this point right now, I'd say so far for this week, I know it is a little early in the week, but I would say it's pretty stable.
Thank you. And someone is asking a specific question. If a roommate tested positive and comes back to the room, will the negative roommate continue to room with them?
So if a person is positive and they completed their isolation, there is no reason why the negative person can't live with the completed isolated period of time patient. So having a positive and doing the isolation time does not rule out living with somebody that is negative.
Thank you.
Julia, can I add a comment to that?
Of course.
One of the things that I want to make sure that is clear is sometimes we have students that are testing off campus and they may self-isolate, which is that they decide that they're not going to report to the university that they have tested positive, and that may be somebody that comes back to the room. That is not permitted. All students who know that they are either high contacts or testing positive must report that to Housing and Residential Education if it is that they have not already reported that to Student Health Services. They're supposed to be filling out the daily symptom tracker with that information. So we want to make sure that no student is put in a situation where they may be negative and then they know that their roommate is positive and their roommate has decided to stay in the traditional residence hall that they have been assigned. So that is not permitted. If that happens, the student should contact their RA, contact their RLC, contact Housing or Student Health in some way to let us know that so that we can take the appropriate steps.
Thank you, Anna.
Thank you, Anna. I completely agree with everything you said.
And Dr. Puccio, Kimberly is asking an interesting question. Is there any data on long-term impacts of COVID on young adults?
So the short answer is no. However, we're 8 months into the novel coronavirus, and there are many people trying to collect as much data on young adults as much as possible, because we do know that most young adults have very mild cases, but we just do not know what's in store 6 months to a year down the road. So one of the things that I strongly recommend is that anybody who has tested positive, if they're not feeling right, if they feel like their symptoms have never 100% improved, it is really advisable to make sure that you stay in contact with a medical provider so that we could get you in contact with people that are specialists that are collecting data on this so that we could figure out and treat you the best way possible.
Thank you. And so we're getting to the end of my pre-planned questions. So the last two questions that I did have to do with how long a student stays in isolation and what the process looks like to be cleared. And between the questions that have come in through the audience, we've touched on this a lot. But just as a recap, Dr. Puccio, would you be able to just recap what we've talked about today with the isolation process, how long that usually is, and how they know and are alerted that they are ready to be released from isolation?
Okay, thank you. It is very confusing for everyone. So I'm going to repeat the three categories. There's symptomatic people. There are people that have had exposure who we consider high-risk contacts, and then we have patients that have been definitively diagnosed as COVID positive. For somebody that is COVID positive, if they are on isolation for 10 days, their 10-day isolation depends on if they were symptomatic or if they were asymptomatic on their test date. So those are two important questions that if you are COVID-19 positive, you have to look at those two questions. If you are a high-risk contact person to someone with COVID-19, you're going to be, in general, in isolation for 14 days. During those 14 days, we probably would want to test you around day 5, 6, or 7 for the development of the antigen or a positive PCR. If you do test positive at that point, usually what we look at is that you would be in isolation 10 days from that positive date. People that are also in high risk contact isolation, we're watching you for developing of any symptoms. So you may test negative for your test around day 5, 6, or 7, but at day 11 or 12, you may start developing symptoms, and that may cause us to retest you again. And if you do test positive at that point, we would need to keep you in isolation for 10 days from that point. And then there are people that are symptomatic, and those people would go into isolation and we would test them. And if they test both PCR and antigen negative, then what we would look at in that scenario is, are their symptoms improving? If their symptoms are improving and they are negative, and if we could find, and this is not necessarily, we try to look for another diagnosis. If we find one, great. If we don't, but your symptoms are improving and you're feeling a lot better, we will release you from isolation. However, if your symptoms are worsening and we can't figure out a cause for that, we will probably keep you in isolation and retest you, and sometimes serially retest you until we see either a positive test come about or we start seeing resolvement of symptoms.
Thank you for that. I know there's a lot of specific scenarios and, obviously it's on a case-by-case basis sometimes, so I appreciate that recap, and I'm sure the audience does as well. So a question from the audience, can a family member pull a student out of isolation after they have been in for a few days? For example, in case it may take a couple of days for an out-of-state family member to drive down and get their student if that's what they choose to do.
So the answer to that question is yes. We really do not want the parent to go into the isolation space, only because we don't want to put them at risk. But if the student wants to leave with the parents, they can leave with the parents. But once they leave, we really are requesting that they do not come back to campus until they completed their isolation period.
Great, thank you. That answers a couple other questions about students going home. So, and Anna, go ahead.
I just want to add, and so that should not be done independently. That should be done in consultation with Student Health Services. So we need to be able to track where students are, when they're able to return, et cetera. So while the option is certainly there, we need to make sure that the consultation remains with Student Health Services, because Housing and Residential Education will be looking for that guidance from Student Health Services as to why somebody may be out of their isolation space. And so we don't want to mistakenly think that somebody is breaking isolation because they have decided to go home or to isolate off campus without being approved to do so. So I just want to make sure that we have a good wraparound, that option is available, but it still takes consultation and communication.
Great, thank you for that.
Absolutely, Anna, thank you.
And Stacy is asking, Dr. Puccio, is Student Health Services offering any antibody tests to the students that do test positive?
So in general, no, only because we know that the PCR test is so reliable. If a student really wants to get antibody tested after their isolation period, they could set up a telehealth appointment and discuss that with their medical provider. But as I kind of cautioned before, the antibody tests are not the most reliable test. We have seen people that have tested positive that never produced any antibodies. And a lot of times it's really dependent on the test. We've gone through several different tests, and we find some tests are more sensitive than other tests. So it's really hard to discuss whether antibody testing is recommended on a general basis, just because they're not so reliable right now.
That makes sense. Thank you. So we have gotten through the pre-planned questions and the questions from the audience that I had ready for you all. I do want to just let the audience know that if you didn't have a chance to ask your question or your question wasn't answered, we are going to be planning weekly chats with Anna to be able to answer your questions as the semester progresses. And next Wednesday, we do have a Facebook Live planned with David Kloiber from our assignments team to talk about room selection for the spring semester. So we're really excited to have Dave on the show and to be answering your questions live then. So just be on the lookout on our Facebook page for more information about those weekly live chats with Anna. So before we go tonight, I want to give you both the opportunity to give any closing comments that you have. And again, thank you so much for your time, taking the time out of your Tuesday to spend with us and answer all these questions. So Anna, any closing comments that you have on your end?
Sure. I'd like to start first by just thanking Dr. Puccio for not only his time this evening, but the dedicated time that he and his staff have been putting into the planning process, the screening process, the testing process, the responding process to this pandemic. It's been remarkable and inspiring, and so I'm glad to be able to partner with you on that. I also am very glad that when you were able to provide all of the different scenarios, maybe not all of them, but the recap at minute 45 in this recorded session, I think is going to be played over and over again, because we know that students and their families are interested in information, but when it really becomes their information and affecting them and their families, they have a different way to listen to the information. And so I'm sure that this is a recording that will be listened to multiple times by people as we go through this process. And so thank you very much for making yourself available for this. And of course, to the team, I really appreciate, Julia, you pulling all of this together, and all of the folks behind the scenes to make this happen. We know that this is a stressful time for students and families, and we want to try to give you the confidence that students are cared for, that there is a plan that is in place, and also the opportunity, if it is that something doesn't sound right, that you have the opportunity to ask the questions and get them answered. And so thank you, Dr. Puccio, Julia, and the rest of the team, and thank you for the parents and families and students who gave us such great questions to be able to make this a robust evening. So thanks so much.
Thank you, Anna. Dr. Puccio?
I wanted to take the opportunity to thank everyone also involved in providing this Facebook Live presentation. I also want to thank Anna and everybody in housing and residential education. They've been wonderful partners. This is all a new experience for everyone, and we really have learned from each other as we put this process through. Nobody is perfect, so it's always a learning process. And we learn a lot from everybody, sharing what their experiences are, what their confusions may be. So we really thank everybody for contributing to the questions and any comments that you do have. So we are very, very appreciative of that. My last parting words for today is just things of precaution. I know, probably by now everyone is sick of hearing, make sure you wash your hands for 20 seconds. Make sure you wash your hands very thoroughly. Remember, if you're opening doorknobs, if you're opening any type of common places, try to use other parts of your body besides your hands. Remember to keep your physical distance between people, 6 feet, and making sure that you are always wearing your mask. I know the masks are itchy. I know sometimes they could dry your throat out. That's what I have right now. But really, it is probably our best defense mechanism at this point. And the other thing is, we are all social people. We all want to do things and have fun. I do want to caution people to make sure that any types of groups that they may be part of, is that you really keep the numbers low, and so that you don't put yourself at unnecessary risk, and that you keep yourself safe throughout the rest of the semester. We're here to take care of you, but most of all, we want you to stay safe and to try to stay as healthy as possible. And any ways that we could do that, we'd be more than happy to assist. So any questions, feel free to contact SAHS or request a telehealth appointment to speak to one of our medical providers. And thank you again for inviting me to this great presentation.
And thank you both so much again for your time. And everyone watching, be sure to keep an eye out for more information about some weekly chats where we continue to answer all of your questions. Thank you again.
And don't forget a flu shot.
Oh yeah, flu shot, don't forget. All right, thank you both and have a great night, everyone. Bye.
Bye-bye.